In a move that has sparked both hope and controversy, Dr. Mehmet Oz has been confirmed as the new head of the Centers for Medicare and Medicaid Services, or CMS. This influential position gives Dr. Oz significant power to shape healthcare in America. He will oversee Medicare, Medicaid, and the Affordable Care Act, impacting millions. Dr. Oz's background as a renowned heart surgeon and popular television personality precedes him. However, Dr. Oz's confirmation was not without its critics. Some questioned his lack of experience in government bureaucracy. Others pointed to past controversies surrounding some of the health products he promoted on his show. However, Dr. Oz's supporters praised his commitment to public health and his ability to communicate complex medical information in an understandable way. The Senate confirmed Dr. Oz by a vote of 53 to 45, a relatively narrow margin reflecting the divided opinions surrounding his appointment. This appointment marks a significant shift for CMS, an agency often seen as bureaucratic and slow to change. Dr. Oz's supporters hope his outsider status and media savvy will bring a fresh perspective and much-needed innovation. Dr. Oz has articulated a vision for CMS that prioritizes modernization and proactive healthcare. He has spoken about his desire to leverage technology to improve efficiency and patient outcomes. Telemedicine, remote patient monitoring, and artificial intelligence are all areas he has highlighted as holding potential for transforming healthcare delivery. Central to Dr. Oz's vision is a focus on preventative care and addressing the root causes of chronic diseases. This aligns with Health Secretary Robert F. Kennedy Jr.'s Make America Healthy Again campaign, which emphasizes lifestyle changes and personal responsibility in healthcare. Dr. Oz has been a vocal supporter of this campaign, frequently hosting Kennedy and his team on his television platform. This emphasis on preventative care and personal responsibility has resonated with some, particularly those who believe lifestyle choices play a significant role in health outcomes. However, critics argue that this approach oversimplifies complex health issues and may disproportionately impact those with limited access to resources and healthcare. Dr. Oz takes the helm of CMS amidst a period of significant staffing changes within the agency. While CMS has been relatively spared compared to other health agencies, it is still facing a reduction of approximately 300 staff members. These cuts come as part of broader reductions in the Department of Health and Human Services under the Kennedy administration. Of particular concern are the cuts affecting programs focused on minority health and cost reduction in healthcare delivery. These programs play a vital role in addressing health disparities and ensuring access to affordable care for vulnerable populations. The loss of experienced personnel in these areas could hinder progress and exacerbate existing inequalities in the healthcare system. Advocates for minority health and healthcare affordability have expressed concerns about the impact of these staffing reductions. They argue that these cuts will disproportionately impact communities already facing significant health disparities. It remains to be seen how Dr. Oz plans to address these concerns and ensure the continued effectiveness of these vital programs. GAP3's Dr. Oz has been a strong advocate for telemedicine, believing it to be a key component in modernizing healthcare. His vision for telemedicine revolves around expanding its reach, particularly to rural and underserved communities. This approach aligns with his broader goal of making healthcare more accessible and equitable for all Americans. GAP3's telemedicine offers numerous potential benefits. It can bridge the gap for patients who live far from healthcare facilities, providing them with timely consultations and follow-ups without the need for long-distance travel. Additionally, telemedicine can help alleviate the burden on overcrowded hospitals and clinics by offering an alternative for non-emergency cases. GAP3's. However, the expansion of telemedicine is not without its challenges. Issues such as internet connectivity, especially in remote areas, need to be addressed to ensure that telemedicine services are truly accessible to everyone. There are also concerns about the quality of care and the ability to accurately diagnose and treat patients without face-to-face interactions. GAP3's. Dr. Oz plans to tackle these challenges head-on. He envisions a future where telemedicine is seamlessly integrated into the healthcare system, supported by robust infrastructure and policies that ensure high standards of care. By leveraging technology and innovation, Dr. Oz aims to transform telemedicine from a supplementary service into a cornerstone of modern healthcare. Gap 3S. As Dr. Oz embarks on this ambitious journey, the success of his telemedicine initiatives will depend on collaboration with stakeholders across the healthcare spectrum. From policymakers to healthcare providers to tech companies, a collective effort will be essential to realize the full potential of telemedicine and create a more inclusive healthcare system for all. Gap 3S. The public reaction to Dr. Oz's appointment has been mixed. While some praise his innovative ideas and media presence, others are skeptical about his lack of experience in government. This chapter will delve into the various public opinions and what they mean for his tenure at CMS. Gap 3S. On one hand, Dr. Oz's supporters highlight his extensive medical background and his ability to communicate complex health issues to the public. They believe his media-savvy persona can bring much-needed attention to important healthcare reforms. Advocates argue that his fresh perspective could break through the bureaucratic inertia that often hampers progress in large government agencies. Gap 3S. However, critics voice concerns about his qualifications for such a pivotal role. They point out that while Dr. Oz is a renowned cardiothoracic surgeon and television personality, he lacks experience in managing large governmental organizations like CMS. Skeptics worry that his approach may oversimplify the complexities of healthcare policy and fail to address the nuanced needs of diverse populations. Gap 3S. Public opinion is further divided along political lines. Some see his appointment as a bold move towards innovation in healthcare, while others view it as a risky gamble. This polarization reflects broader debates about the direction of healthcare in America and the role of non-traditional leaders in government. Gap 3S. As Dr. Oz begins his tenure at CMS, the varying public opinions will undoubtedly influence his strategies and policies. Winning over skeptics and proving his capability to lead one of the nation's most critical agencies will be crucial for his success. Gap 3S. Ultimately, Dr. Oz's legacy at CMS will be shaped not just by his vision and initiatives, but also by how effectively he can navigate the public's expectations and concerns. Only time will reveal whether his unconventional appointment will bring about the transformative changes his supporters hope for, or if the challenges will outweigh the potential benefits. Gap 3S. The future of Medicare and Medicaid is a pressing concern as Dr. Oz takes the helm at CMS. These programs are lifelines for millions of Americans, providing critical healthcare services to the elderly, disabled, and low-income populations. Dr. Oz's policies will undoubtedly shape how these programs evolve and adapt to changing healthcare needs. Gap 3S. One of Dr. Oz's primary focuses is modernization. He aims to leverage cutting-edge technology to streamline operations and improve service delivery. This could mean faster processing times for claims, better access to patient records, and enhanced telemedicine services for beneficiaries. Gap 3S. However, modernization comes with challenges. Implementing new technologies requires significant investment and training, and there are concerns about data security and privacy. Dr. Oz will need to ensure that these changes do not disrupt the services that beneficiaries rely on daily. Gap 3S. Another key area of focus for Dr. Oz is preventative care. By emphasizing early intervention and healthy living, he hopes to reduce the long-term costs associated with chronic diseases. This could involve new wellness programs, incentives for healthy behaviors, and expanded access to preventative screenings. Gap 3S. Critics, however, worry that an overemphasis on personal responsibility could lead to cuts in essential services. Vulnerable populations who rely on Medicare and Medicaid may face barriers to accessing the care they need if resources are reallocated to other areas. Balancing preventative care with the ongoing needs of these populations will be a delicate task. Gap 3S. As Dr. Oz's tenure progresses, the impact of his policies on Medicare and Medicaid will become clearer. His approach to modernization and preventative care has the potential to bring about significant improvements, but it will also require careful management to avoid unintended consequences. Gap 3S. Ultimately, the evolution of Medicare and Medicaid under Dr. Oz's leadership will be a critical factor in determining his success at CMS. These programs are vital to the health and well-being of millions, and their future will be closely watched by policymakers, healthcare providers, and beneficiaries alike. The appointment of Dr. Oz as head of CMS has the potential to significantly impact the healthcare landscape in America. His emphasis on modernization, preventative care, and personal responsibility could lead to significant changes in how healthcare is delivered and paid for. How these changes will ultimately affect the cost and quality of healthcare remains to be seen. Some experts believe that Dr. Oz's focus on technology and preventative care could lead to long-term cost savings by reducing the need for expensive treatments for chronic diseases. Others worry that his emphasis on personal responsibility could lead to cuts in essential services for those who need them most. The impact of Dr. Oz's leadership on CMS will unfold in the coming months and years. His success will depend on his ability to navigate the complexities of the American healthcare system, balance competing priorities, and build consensus around his vision for a healthier America. Only time will tell what legacy Dr. Oz will leave on the nation's healthcare system.